Great. Well, thank you all very much for choosing to come to the Healthy Communities session here and just doing this track today. This is hopefully going to be a very interesting and robust dialogue about the relationship between the built environment and health. And that's really, when I talk about healthy communities, I'm talking about sort of built environments, sort of the buildings and the parks and the roads and the trails and everything else that we construct and create and modify that we know influences health. So that's really what we're going to be focusing on today in a couple of different ways. My name is Steve White. I work at the Oregon Public Health Institute. OPHI is a private nonprofit based here in Portland, Oregon. We've been around for about a dozen years under a couple of different names. We are primarily a policy and systems change focused organization, so we really got our start in the early 2000s focusing on childhood obesity issues and upstream determinants of childhood obesity issues, so work on a lot of things like healthy community design, looking for ways to improve physical activity and nutrition for kids by working in different environments. We also are, as a public health institute, we really work to try and support our local and state health departments, fill in gaps, work on issues that maybe for one reason or another aren't necessarily getting fully addressed through the traditional public health system. So that's enough about my organization. Myself, I have been working at OPHI for about 5 years. I actually have a background in land use and transportation planning, so I've been working pretty much my entire public health career on built environment and health issues. So it's something I'm very excited about and something I'm very happy to be talking with you about as well. So just to give you sort of a frame of the day and what it is we hope to be accomplishing here throughout the course of the day, there are some key questions that I sat down and thought, okay, these are some questions that I'm hoping we're going to be able to get to, and that you all, as we go through the day, will have at least be able to answer these at some high level. So first question, what's the connection between the built environment and health equity? So talk a little bit about that. I mean, just sort of the basics. I think some of us probably already have a decent sense of this. We're going to ask ourselves what forces shape our built environment. So if we think about, how do we change our built environment? How do we make sure that the communities that we develop and redevelop are going to be more promoting of good health? What are those forces and how can we interact with them? What role do planning agencies play in shaping the built environments? There is going to be a focus on public planning agencies. I know there are a lot of different forces that shape the built environment, but when we think about places where we can engage as citizens, public agencies, planning agencies in Oregon all have a citizen engagement component to a lot of the work that they do. So when a plan is being developed, whether it's a neighborhood plan or a comprehensive plan, we'll talk more about what those mean, but when plans are developed, there's a requirement that there's a certain level of citizen involvement, that there are public meetings, there are opportunities to provide input from different individuals and organizations. So in terms of a place where I think there's ripe opportunity for you all to potentially get engaged and involved in healthy community planning efforts, that is one kind of big target area, and we'll talk a fair bit more about that in the afternoon, and I'll have a couple of planners here to talk about some of their work and answer any questions that you all might have. So following that, what actions can we take to ensure that planning decisions improve health and health equity? So thinking about that, how do we engage in planning processes to ensure that the outcomes are supportive of good health? What are some of those ideas for being effective in getting involved in planning processes? And then also, how can individuals and organizations influence planning projects and other activities that can shape our built environment? So again, as we talk about these things, we're really going to be looking at them with an eye to what it is you all can do and how you all can be involved in shaping the communities in which you all live and work and play. Key outcomes, so as we answer those questions, my hope is that you will learn about how the built environment impacts health, just get a better sense of what we're talking about there, learn about how communities are planned and developed, begin to learn about each other's work, and develop relationships that might serve as a foundation for an ongoing informal community of practice. So going forward, I know probably not all of you are from the same community, but there's probably some overlap, and certainly at an organizational level, there might be some fruitful opportunities to begin to think about working together at the very least. Identify opportunities for action to support healthy community planning and development in their communities, and I think really this is a lot of what this conference is about, is really not just sort of identifying and understanding issues, but thinking about how it is that we can act. And then hopefully, as we think about this and you all identify opportunities, that there will be an interest in committing to completing at least one action to support healthy community planning and development in your communities. So in terms of how we're going to do this, as soon as I'm done going through this, we're going to take a few minutes to do some introductions. I really want to get a sense of who's in the room. That was kind of a bit of a black box to me when when I saw the diversity of organizations that come to this event every year and how it's sort of changed over the years. I'm very interested to find out, and that will certainly influence how we move through the day. We're going to spend a few minutes envisioning healthy communities. You all are going to be able to test your art skills a little bit and do some drawing. I've got some flip charts over here. We've got a whiteboard over here so that you all can do some artwork. Key terms and concepts. Anytime you're bringing different disciplines together, like public health and planning, sort of step one is making sure that we can speak each other's language, and so you're certainly not going to be fluent in both public health and planning, but I think hopefully have some key concepts down enough to understand what we talk about today, and hopefully enough to also really get you sort of set up to engage in other efforts after you leave this room. So that'll be the morning. In the afternoon, we're going to have a panel discussion. The panelists include two planners from the city of Portland who do a lot of public engagement and work with different communities on different planning projects. We're also going to have Tony Delfaco, who is a community development professional, I guess, does a great deal of work in Northeast Portland here. He's going to talk about more of the implementation. So people plan, and you have a plan, but then what actually, the plan guides development, and actually the activities of people like Tony and other developers and people who are actually out there building things are the ones who really also determine how our communities are shaped. So, we plan, and then we do, and then there are different opportunities during planning and doing to actually get involved. So we'll talk about that, and then we'll do a fair bit of action planning in small groups so that you all can really sort of discuss issues and ideas. And we'll do some brainstorming, we'll do some more discussion, and we'll identify some great ideas and hopefully ideas that people can really follow up on. Real quick, a sense of public health system. It sounds like that's what most of us are, but to sort of give us another way of dissecting this, raise your hand if you would say that you work in the public health sector. So as opposed to what I would say is the health system sector, so hospitals and health systems. So the other, we have intertwine, which is sort of trails, nature, recreation, and anyone else who is not.
Non-profit.
So also look around, and part of this is to give you all a sense of who's in the room too. Public agencies, raise your hand up very high. Private sector.
How about unemployed?
Okay. Unemployed. We've got at least 3, 4, 5. Great. So if anybody has some jobs. All right. So just some quick definitions, knowing who's in the room. I guess as a lot of you probably know these. A couple of us might not be quite so familiar, but some key terms that I'll be throwing out throughout the day that I just want to make sure we're on the same page about. The first is what we mean when we talk about health. This definition of health here is kind of the standard one used in the public health world. It comes from the World Health Organization. What we mean when we say health, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. I'm also going to talk a fair bit about health determinants. So health determinants are the range of social, personal, economic, and environmental factors which determine the health status of individuals or population. Examples of determinants include behavioral determinants, such as consumption of fruits and vegetables, the choice of whether or not to smoke. There are environmental determinants, such as air quality and water quality, but also within the built environment, we talk about access to healthy food, opportunities for physical activity. Those are determinants of health that we know through research are linked to health outcomes. Health outcome is the health status of individual, group, or population, which is attributable to a number of determining factors, such as behaviors, social and community environments, healthcare services, and genetics. Examples include diabetes, cholesterol level. I think of it as kind of anything that your doctor is going to tell you that you have and need to deal with. One way that we envision this in the public health sector, and I guess as a lot of you are sort of familiar with this general visualization, but if we have our public health rainbow or onion here, we have health at the bottom. Here are the things that we know really impact health, and as you sort of get out, the impacts broaden. So if you start here, we know that health is determined in part by individual factors such as your age or gender, genetics, and then beyond that, individual behaviors such as diet, exercise, drug addiction, that sort of a thing. And then as you go out into these sort of public services and infrastructure, living in working conditions, social, economic, and political factors, we're getting broader and broader, and the impacts get a little less direct, but also tend to get amplified because everything on the ring impacts everything sort of underneath there. So if you think about education or income, for example, income determines so many different, or has so many different ways that it actually ultimately impacts health in terms of where you can afford to live, what sort of food you buy, what sort of choices you have, what sort of education you can get, all sorts of different things. The challenge, of course, is that while we know that this is where health happens, this has traditionally been where most of our health care and our health issues have focused really on individual behaviors, individual factors, and much less so out here, although I think this is really starting to change. So that we're really starting to realize that that these conditions out here, out in the world around us, that we don't typically think about as health issues, are really what explain health disparities and really help understand why we have the health outcomes that we have in this country. And that also helps us understand why it is we focus on policy, why I focus a lot on planning. This is a pyramid, a graphic that we often use in public health to kind of explain why we focus where we do. If we think about kind of where impact is and sort of impact for amount of effort, as you sort of increase effort and focus on the individual, you kind of lessen the actual impact that you have on a population scale. So if you're looking at educating and counseling individuals, it takes a lot of effort, but there's really not a lot of bang for your buck in terms of the size of the population that you can impact. But as you sort of go down and sort of away from the individual and start focusing on policies, plans, laws, and regulations that affect us as a population, those tend to be the areas that you can have the greatest impact. And certainly, when we think about where we put our public health effort and whatnot, there's really a lot of potential to have a large-scale impact by focusing on policies and systems that help shape the choices that we make. This is a famous tree exercise. How many people have done a tree exercise before? Does this look familiar? Raise your hand. Okay, good. So this is our tree, and we're going to start up here with some health outcomes. So give me some health outcomes. Just kind of shout it out. What's a health outcome? Diabetes.
Hypertension.
Obesity. What else? Asthma. Suicide? Okay. Cancer.
Cardiovascular disease.
All right, I'm just going to say CV disease. All right, let's get one more. Addiction? Okay. Okay, so we're going to put a little star next to this one. So let's think about some behaviors that actually influence whether or not you might get one of these diseases or health outcomes. So think about just behaviors.
What you eat.
What you eat, diet,
Sedentary lifestyles. So diet, Santa.
Oh, is that
Sedentary.
Oh, sedentary.
Yes,
Okay.
sedentary lifestyle.
Okay.
Non-work.
Sitting around.
Right.
Physical inactivity, I guess.
Right, all of that.
Smoking.
Smoking.
Air quality.
Air quality. Let's do AQ.
What about,
So
Education.
would it be breathing then?
what was that?
Education.
Education? Education on a lot of different levels, right?
Right.
Knowing about
Right.
health, sort of health literacy, but also just
All of
everything
it.
else. Let's see here. Let's go up. I just want to think a little bit through this one a little bit more. What would we think about behaviors or something kind of related to suicide? I think, what's that?
Mental illness.
Mental illness? Would you call that I mean, that's not really a behavior or something, but
Okay.
let's, I mean, I want to raise it because oftentimes we forget about mental health, and so.
Isolation.
Finances?
Finances, what did you say, Marie?
Isolation.
Isolation,
Families.
isolation support systems,
Lack of support system.
lack of support systems,
I don't know, historical trauma, whatever.
Family history of abuse.
That's why I said historical trauma.
Yeah, and also what sort of adverse childhood experiences, and it seems to be kind of one of the big things that really, that people are focusing on a lot these days. ACEs, one of the newer acronyms I've learned recently. Okay, so we could go on and on there, and I think this is a good list. And so now we think about what influences these behaviors. So, you know, certainly education, I think we could put it here as a behavior, but also something that influences these other behaviors as well. But think about kind of the social or environmental conditions that influence these behaviors. And again, behaviors, since you might not be able to read my lovely writing: diet, sedentary lifestyles, air quality, smoking, education, adverse childhood experiences, isolation, lack of support systems.
Poverty.
Poverty,
Access or opportunity.
Risks.
housing.
Education.
We have that on.
Yeah, and I think we'll
We
do
can
that
say
times
schools.
two. Schools, and that also comes into access as well
Right.
a little bit too, right? I mean,
Or access to healthcare, to timely healthcare, and that comes
Right.
also with education. but-
Right.
I would say in addition to poverty, also economic inequality.
Mhm.
Okay,
Inequality, I guess you could just say.
Jobs.
jobs,
Lack of jobs.
yeah, so I'll just put employment or EMP.
That contributes to suicide too.
Yes, yes, and
Not that we
so,
don't want to.
right, and so we could draw lots of lines connecting all these,
Yeah.
but, so this is, I mean, this is sort of the,
Thank you.
you know, this model that we move to the root causes, or sometimes we also refer to these as like really the upstream determinants of health. And so kind of, you know, we've got this stuff that influences our behaviors influence our health outcomes. All this stuff down here are different types of health determinants, and there's not like one list of health determinant out there. We can describe these in different ways, you know. Availability of sidewalks in your neighborhood is a health determinant, you know, but we could also say pedestrian infrastructure is a health determinant as well. Yes?
Also the area in which you live. I mean, the
Yeah.
space
Yes,
you.
yes, good, because that's what we're going to be talking about here. and certainly one of the things. Yes?
I was just wondering why the outcomes all have to be negative.
You know, that is good because our definition of health is, you know, meant to take us away from that. And I think that's a really good point. And we could definitely write this in a different way. And I agree that that is a good way to shift the conversation or to think about that as well. And, you know, and I have to say I'm kind of guilty of thinking about the negatives as well. So,
I
so
think
good.
it's because those are the ones that we need to look for,
Right.
and
Those
we
are
need
the
to
ones-
work on.
Right,
But I
right.
think sometimes if you shift it to what really works,
Mhm.
then you do have a whole different way of looking at the quote problem.
Yeah, and when we think about trying to change our environments, and I talk to different people about this, do we talk about the negatives to try and get people to change that, or do we kind of entice them more with the positive? And I think we want to create healthy communities. We don't want to, I mean, that's the frame that I typically talk about it in, to highlight the positive. So that's great, and we'll let's make sure that we keep that in mind through our discussions today. Yes.
I think it also was based on he who feels it knows it. The person who's going through that, and that's how they live, that's what they don't see that, that's not necessarily seen as a positive of those, if they live in poverty and all that other type of stuff, that's not gonna make them feel the other side of it.
Right. So you could be healthy, but there would still be, you're not kind of reaching those positives. And pathways,
So
yes.
one other thing was that a mix of housing.
Okay.
Well, mixed use,
This is mixed
yeah,
up.
but
That with
use
local,
also-
with local businesses so that the money stays in the
Right,
community.
and access to
Yeah.
housing for everybody.
Yeah. Great, let's go back here real quick and see what else you all have to add to the list.
Not too much different than what's already been said. We talked about having everything accessible within a 20, you can do it in 20 minutes. Multiple ways of transportation, whether that be the car, public transportation, the bike, the sidewalks, walking trails, our garden. We talked about having a community center for both, everybody really, but really focusing on the elder and a daycare. We talked about a library in the community, having space for sports, church, the health center, and then making sure that you know how to get there. We have directions to the hospital, education, and lots of trees, and just people in the community. Did I miss anything?
And why do you guys like trees?
Why?
Yeah.
nature is
Oh, and then we talked about with the housing, having efficient center in the housing.
Great. Yeah, trees, you know, there's a bumper sticker that I often see that says, trees are the answer, which I sometimes think, you know, it's
All
like trees
we
and
need
bikes,
is
you know.
trees.
Yeah, but, you know, it's like it's air quality, but there's also mental health benefits as well to having greenery around and whatnot, and scrubs air, protects from noise if you're next to a busy roadway, it's a lot of things.
Covers you from the sun also.
Yeah, sunburn, so we can put that as our health outcome too, so. So all really good. You know, there are a couple of things that I like on this list that I don't always see. Oh, were you gonna say?
I was trying to say that like in the nature and just being out in nature is just very healing.
Right.
And there's been studies on it, on just
Oh, yeah.
like literally, or streams or like water or, I mean, all of those things that are fire, water, air, blah, blah,
Yeah.
blah. And how much it does. So that in and of itself could be helping too on multiple levels for a lot of.
Yeah, great. Ben?
Well, I think we should capture, I mean, I was appreciative of the comment around banks, because having capital that's in the community for investment that reflects what we're drawing
Right.
actually takes capital
Yeah.
They
I
should
think-
have put credit unions.
to, or
Right.
credit union.
Well, also, so I mean, there are a couple of really interesting things that don't typically come up. I mean, I think for whatever reason, maybe just the mix in the room, but oftentimes people go more towards, you know, sidewalks and parks and whatnot. But, you know, the strong local economy, I think, is a really interesting one. And certainly when we, you know, not to get too Portland-centric, but if we just think about, you know, Northeast Portland, how they've evolved over years, and you know, some of the many challenges that they've had there is just resources tend to get sucked out of these communities, and so then we've tried to, you know, Albina Community Bank, other places to try and bring it back in there. But I think that's really, really important. I think there's, you know, and then sort of the next question is what is it about, you know, I mean, sort of how do we deal with that through planning and zoning? And that's a pretty complex question that maybe we can save for our panelists if we need a good, difficult question for them to answer. Justice and empowered communities, I think that's always a really interesting one as well, sort of in terms of determining how communities get shaped. People need to feel like they have a voice in their community. They need to be engaged. You know, for a number of years, I was a part of my neighborhood association out there in Brentwood, Darlington, and I did land use and transportation, and I sat there and reviewed every development proposal and commented on it and whatnot. But certainly having those community voices is really crucial to making sure that planners listen to you, because even if you have a very well-intentioned planner, if people from the community aren't there to tell them what the challenges or solutions are, they're just not going to hear it. So. The word access came up a fair bit. That's a really big, I mean, it's very crucial. I think we're really getting a strong sense of access. I said to what I call HSR, health supportive resources. So that's everything from churches, food, education, jobs, community centers.
And health.
What's that? And
health.
And health, yes.
Healthcare down there somewhere, access to healthcare, yeah, so we would have that up there as well, and I think there's really just an increasing understanding about the need for access to communities. I think hopefully a lot of us are familiar with a tool that's been recently developed, well, I guess not that recently, we're in version 2, but Coalition for a Livable Future, which is an organization based in Portland here and works on kind of a regional scale, has what they call a regional equity atlas, and a lot of that has to do with access. You'll open it up and you'll see maps and maps and maps, and it really gets to that, the physical assets in our neighborhoods, and looks at neighborhoods that don't have resources and those that do, with the basic understanding that, in order to access these resources, there has to be some sort of alignment on a spatial level as well. So that's great. Well, we're coming up on our, yes?
Just really, really quick.
Uh-huh.
It might just go without saying, but my biggest bone of contention with trying to have good nutrition is that food is just, some food is so expensive in certain areas or certain
Right.
places or whatever. So I think, I know there's a lot of, I hear all the time, all the ways that we could fix that.
Right.
But I think affordable, healthy food is really important.
Yeah, and when we talk about access too, I think that's a challenge.
Yeah.
I used to be, when I was a master's degree student, I did a big study on food access in Portland and, tried to define it more than just spatial access. Often when we talk about food deserts, we're talking about spatial access, and what gets missed from there is, you could put a Whole Foods out in Rockwood, for example, which is a very low-income community, and that's not going to improve access for anybody, right? So there are a number of different dimensions there, and it's really great to keep those in mind as well.
And we have a lot of neighborhoods, like in Cully, for example, and a little bit where I live in Southeast, where we have a lot of elder populations where the houses were paid, but the taxes are choking the elders.
Right.
And they are forcing them to move out of their homes. Therefore, you lose that part of the community
Right.
from a healthy community.
Yeah, so we could even put tax policy on here.
It doesn't help the elders at all.
Right, and so, but getting back to the displacement gentrification question here, I think that's always a huge one. And when we look at these beautiful communities that we've drawn up here, we create these beautiful communities, but really for whom? And I think that's, it's just it's clearly a challenge that we haven't been able to figure out. Other states are able to use a tool called Inclusionary Zoning, for example, that helps get to some of these issues. But we in the state of Oregon have seen fit to outlaw the use of inclusionary zoning for whatever reason. So it's like one less tool that we have in our toolbox.
What is the inclusionary?
Inclusionary zoning basically allows you to more effectively ensure that you have a mix of affordable housing in a neighborhood. So, right now we think about our tools in Portland, at least when we do urban renewal. In theory, there's supposed to be a 30% set aside, so that the funds generated by urban renewal, 30% of those should go into affordable housing in the urban renewal area. Whether or not that it's actually happens still, it's a challenge. But so there are some tools to try and get at this issue, to try and make sure that people can stay in communities as we improve them, but we're really not very good at it yet.
This needs to be a major public health policy
Yeah.
agenda item
Right.
that is getting left off the table. We talk about and draw these pictures, and then we run into this big, huge wall with this ban on inclusionary zoning over and over and over again.
Yeah.
So hopefully
Yes, how do
everybody's
we get on the
hearing this,
bandwagon
hopefully
and
we
do
keep
it?
saying it, because these are the type of folks that need to be.
Maybe that's one
It
of our
is,
outcomes.
so this is
Who's leading that effort now? Who's talking about that?
Housing Land Advocates talks about it. I'm trying to think, it's always kind of on the radar of like Thousand Friends of Oregon. Upstream Public Health is certainly interested in it. We're somewhat interested in it, but it's just one of these things. It's like once you start to go down that road and do an initial test of sort of political appetite for it, it never seems to rise up enough for somebody to say we really need to hop on this. I think there's kind of, a lack of understanding as well. We think, of what exactly it is and how much it'll get us and whether or not it's worth a big effort. It is a good tool, but it's not going to be the one tool that solves all of our problems. So I think there's also just people trying to decide whether or not it's worth the political capital to do something like that. And basically what you run into is the Home Builders Association, which is a very strong lobby and pretty firmly entrenched. And so, it would take a pretty big lift, I think, to make something like that happen.
We could do it.
Okay, yes.
I think that we have enough people dealing with health and health issues to override the negligent, I say city council, because they have the decision to make for zoning. But we talk about health all by itself. We don't talk about zoning and the effect. And we've got all the people that are talking about health and health disparities to talk about better zoning practices. Inclusionary zoning is just one of them.
Right.
It isn't the whole picture.
Right, right.
But nobody's talking about it except politicians and organizations.
We're gonna start talking about
If
it.
people
Yeah.
started talking about it in these enclaves of health disparities and addressing the issues that we have to, inclusionary zoning is a major issue in that. But people don't know about it.
Right.
If that became a major issue, you'd have to educate people on
Right.
that.
And you have to get,
Inclusionary housing.
Right.
I mean,
Right.
Well. It's calling it inclusionary zoning is like, ugh.
and so part of that
Let's call it
though
housing.
is getting the words health and equity into policy documents and planning documents. And
That's
we'll
right.
talk about that more this afternoon too, and certainly within the city of Portland, and Michelle can talk about this because we've been working with her for about 5 years to get those words in there. There has been some uptake, whether or not, how it gets played out and implemented is always another thing, but there is a bit of that shift. But if we think about things that we can do in this room and have impact, that would be a great strategy, I think. Next time your community is doing a neighborhood plan or a comprehensive plan, make sure that those vision, goals, and objectives include the words health and the words equity.
Right.
Because once you have those there, you've got your anchor. And as you go through, it's like, okay, is the way that we're investing in the city of Portland helping us achieve our goal of equity?
Right.
Well, no, because we're just doing this and we're just pushing people around, and ultimately it's not improving the
Not
conditions, it's
making
not
a
reducing those
difference.
disparities. So you need to have it in there. You need to have the metrics, you need to have the implementation tools.
And those people at that table.
Yeah.
And those
Yeah.
people.
Representatives of all the.
Yeah, at the table.
Right.
We've talked about the implementation of urban renewal. I mean, what's happening on Division is market rate, and because we don't have inclusionary housing laws, there's no way to mandate that you set aside any amount for affordable, subsidized,
Right.
whatever the language is. So there's actually a ban on doing that from a city perspective. So
Right.
we have no way to prevent that from happening. The market does it itself.
Right. And Yolanda?
I have a quick answer to that. You are working for Hacienda, which is a development. You will not understand, it's like they need lawyers really to understand how complex it is to get money from the city to help you build these affordable complexes. And then you have to go through so much red tape and so much yes, no, and we actually experienced one last thing in which the interest rate that they charge, and when you build something on an affordable basis, you are putting basically a like something on your building that for 40 years, for example, you have to keep this, and it's a lot of requirements. So a lot of the builders don't want to do that. Some of the times they don't want to apply for those loans because the interest rate is so expensive that it doesn't make sense for them to go into that route. And even if they are doing for 50% of the median income or 75%, Hacienda was building like 30% and 50%, and sometimes they have to put really complex loans together for many different things that are really, I tell you, you need a law degree to understand everything. So just so that they can rebuild Clara Vista, that they want, it's going to go from 140 to 170, something like that. So more and nicer and better looking and everything. But it's very complex and very difficult to go through the city and the zoning and all the planning that takes just to get that done. It's incredible. That's why, people prefer just to build whatever they can and try to make the money in a different way.
And it's a really hard thing. It's running businesses. So we've had enterprises succeed, and I spent 5 years developing our Verde energy enterprise, which weatherized single-family homes, and we had to cease operations last spring because to some extent the kinds of investments that the federal government was making and the state was making in weatherizing homes and prioritizing equity in terms of who was going to get the jobs and who was going to get the contracts, that commitment to equity dried up. You know, you certainly have to compete. You certainly, you know, in the open marketplace, but we also have to have that ongoing commitment from the public sector to addressing the disparities that have been mentioned before to help small minority and women-owned businesses succeed in these very competitive marketplaces. And that works to do two things. One is you get the work done, you get the benefits of, you know, green infrastructure being built, which is what we do. But then you're also addressing poverty at the same time. And so you're having those broader benefits across the community. And I think that what you're seeing more and more is a realization in the public sector and the private sector that, you know, we need to do more with any given dollar that we spend. We need to get equity benefits out of it. We need to get environmental benefits out of it and economic benefits out of it. And we're really trying to do that at Verde and show how you can do that in other sectors as well.
Great. Another question? Yes.
Well, I'm not sure if it's really a question, maybe a question from out of this statement maybe. My name is David Cohen. I'm with the Intertwined Alliance. Just attended the Oregon Active Transportation Summit on Monday of this week and heard a great presentation by a man from Mike Dahlstrom from Washington County. They're doing a big comprehensive plan in Washington County, a multi-million-dollar plan where they prioritized community engagement. As part of that, spent $500,000 of that money they got for their planning process just on community engagement. Worked with CIO and a number of other organizations. Fantastic presentation, the best I thought of the entire conference. But really talked about the resources you really need to commit to doing this if you want to try to do it right. And so that's something that we clearly, governments, groups have to prioritize and put resources there if they really want to do it. And I think they learned, you know, they had misses and hits with it, but they learned a lot about how to really get those other voices heard that don't get heard, and the things that have to be done. I was going to also maybe tee Tony up a little bit to talk about Cully Park a little bit. I mean, you touched on some key things, but Portland Parks, you know, has been planning parks for ever and ever. And they've been doing it one way, or maybe it's evolved. I guess I'm sure it's evolved the way they plan. But I think their experience with working with Tony and Verde and the Cully neighborhood was truly remarkable in my mind, and really transformed an organization, Portland Parks, to really think totally differently about the way they do business. And I know you touched on a few things, but maybe you could talk a little bit more about
Sure. the park. Yeah, and you know, I had the good fortune to be able to visit with Mike Dahlstrom out there in Aloha Reedville. Who knows where the Aloha Reedville area is? So you know how messed up the transportation is there. I mean, you know, it's bad. There's no sidewalks. There's ditches. You know, I mean, it's sort of unbelievable. And what they've done in Washington County that's really innovative is they've said, you know, we don't have the capacity from our agency to know how to engage this very diverse community. But we know that we want them to be agents of change in how we improve transportation in that neighborhood. So how do we, you know, who do we identify to help us do that work? So Center for Intercultural Organizing, doing some of the best community engagement work in Washington County. I highly recommend that if you're doing work out in Washington County. And Centro Cultural, you know, long-time Latino serving organization. And, you know, they've had a lot of success. The challenge is how do you move people up into leadership levels? And so we talked about that, and it's a good idea, but how do you get someone who lives in Aloha Reedville, who, you know, knows what it's like to not be able to walk on their street safely at night, into the Washington County Commission? And so that's got to be a very intentional effort, leadership training, mentoring opportunities, you know, specifically getting people into those positions of power. And I think that it benefits everyone. And that's what I think Washington County is starting to do, and I'm really encouraged by that. The Cully Park example, started with, a landfill being sited in a low-income neighborhood in 1980. So just to give you an idea of the political power of the Cully neighborhood in 1980, it got a landfill sited in the neighborhood, right up to the backs of people's homes. So, from a health perspective, not good.
And no parks.
And no parks. See, claro. So the neighborhood advocated for, converting that brownfield site into a park for over 20 years. And the Parks Bureau, finally did a master planning process in 2006 under Mayor Potter at the behest of the community. Verde, we brought actual $25,000 to that process to get Spanish-speaking people in the process. And, but since then it was like, a master plan, no money to build it, commitment to build it, but no money. So we said, well, we'll build it ourselves. And the Parks Bureau said, who are you? And so we said, well, we're just going to go ahead and build it, and we'll keep you posted. So, and it wasn't arrogance, it wasn't, it was frustration. It was a community frustrated with not having what they needed, a place to recreate safely, a place to meet each other, I mean, we have people that have lived in the neighborhood for 20 years across the street from each other that don't know each other because they can't walk on the street because it's not safe. So we really tapped into that community desire, and we just started to put muscle onto that desire. And so we started raising money. We started engaging youth and adults in all aspects of development of the park. And it was different for the Parks Bureau, and it was different for the Department of Environmental Quality and the Oregon Health Authority, and it's been a really, challenging at times. But I think you're right that there's something there about, communities empowering themselves to bring the assets they need in. That being said, I think there's a lot of capacity that needs to get built in other communities like Cully to get to the point where they can say, yeah, we need a park and we're going to build it too. And I think that's what we're really interested in. And how does the comp plan, for example, drive that? How does the comp plan drive developers to say, we have to do more when we develop in this community to create the economic benefits or the community benefits to build social capital for people to start to have greater impact in their neighborhood. And I think, I've seen innovative things in San Diego, for example, around economic development and their comprehensive plan. And unfortunately, I haven't been able to engage in the comp plan here. So I know there's some good stuff in there. I'm really eager to find out more about it. But I think it's how do you get these kinds of examples that are happening elsewhere in the city as well, institutionalized as this is our business as usual because we need to address disparities over the next 30 years.
Yes, one last question.
I actually want to put a blog on tag along what Tony said. I think part of the frustration that a lot of our community feels, and I'm sure if you read the Communities of Color report, is that people like me, for example, that I went to school to get an MBA so that I could implement policy that will affect my community, I get always branded, oh, you speak Spanish, you can tell people in the front. And for me, breaking that barrier is so difficult because not only am I a woman, I'm a Latino. And that also is like a double whammy for me to be able to break into policy making areas of the city, of the state, of the county even. Trying to say, you know what, you are just looking very white here and you don't look at other areas. And it's unfortunately because it has to happen that people like Verde had to come and say, we're going to build it, whether or not you want it, and they are like, and you are who, and where are you? They have no idea that we exist at some point in time. So that's for me that I'm an unemployed, right? The unemployed that are here. Yeah.
Yes, Michelle.
I want to, if I can, speak to three things that we are trying to do to hopefully address some of these concerns. And I want to state up front that Portland planning is not perfect. We are trying to improve. Three things that kind of I've heard talked about a little bit. One is in terms of advisory committees. Oftentimes advisory committees are city staff and they sit in a conference room and they make plans. And what we've tried to do, particularly in these last two plans, is open that up and say, you know what, we want community members, members from other agencies, members from groups like Verde sitting physically at that table. When you say come to the table, literally at the table, and working almost as staff people to develop a plan from the very beginning. Another thing that we've tried to do is use what we call diversity and civic leadership partnerships, which were partnerships with community organizations to do direct, both capacity building and direct involvement to their communities. Sometimes as planners, oftentimes as planners, we don't have the tools and the local expertise that's really necessary to have that valuable community conversation. So how can we enable other groups to do that and to probably do it in a better way and still have a very clear channel of how that information can come back into the decision-making process. And then the third thing that we've tried to do is rather than have a, hey, we're having an open house today from 4 to 6, can you come and look at our boards, is to shift how we're thinking about those sorts of open houses, and rather than doing it that way, to say, you know what, we're going to send a staff person to your meeting. It could be the Intertwine Alliance, it could be Hacienda, it could be any group that has an established meeting that could care about this issue, where we can come into that space and talk about their issues and really hear from people in a more nuanced way. And so I just wanted to mention those as things that if you are in Portland, so you know that we are trying to move forward. If you're not in Portland, it may be helpful to advocate for some different models of community involvement.
And that's very genuine and real. We recently completed an effort with the Bureau of Planning and Sustainability where we jointly raised funds together. So Michael Armstrong on the sustainability side, and we did with Hacienda. So Bureau of Planning and Sustainability, Hacienda and Verde, and we did some charrettes workshops with young people at Hacienda to understand and adults to understand, well, what does green building mean to you? What are the important things to have in the housing that we're going to build for you in the future? And that then is being incorporated as information for how the Bureau works with other low-income communities and communities of color and understanding what's important around this term of sustainability, and how do we reshape how we work to incorporate the needs and desires of low-income people and people of color into our everyday practices. And it's been really a great experience, and I think that we're both learning more about each other. So I think more partnerships like that between community and city are valuable. The foundations reward that they want to see it because you could have greater impact rather than just you here on your own on the community side going, hey, we're going to do the park, and the city over there going, well, we don't know. It works a lot better when you're together, I can tell you that. And then we had another project recently where we were able to get funding, and the Bureau of Planning and Sustainability again brought in 6 groups of people of color to talk about climate and how to revise the climate action plan. First time that had ever been done, where they said, hey, these voices have not been at the table. We recognize that, and in order to have an effective climate strategy that involves all of our residents, we have to understand where folks are coming from. And so we paid them to be part of that process, stipends for people to participate. It wasn't a lot of money, probably wasn't enough, but it was something, and I think there's been some good data. You guys may have different opinions, but that's been my experience with it. And I know it's a tale of two cities over there at planning and sustainability. There's the planning and the sustainability, and they don't always meet. They have their own thing of trying to get together sometimes.
But the whole entire Bureau of Planning and Sustainability has, for the last year, had the first time we've had an equity specialist on board. And that's been really great because that's her job, is to basically kind of look at the sustainability side and the planning side and ask those questions about, what kind of outreach are you doing? What kind of equity lens is being applied to your projects? And she's coming up with some tools that we can systematically look at things, because for a long time we knew we weren't doing a great job, but it was really hard to know what to do and to fund it and to make sure that you had enough money to fund the stuff you wanted to do. So I think if you do participate at the Planning and Sustainability Commission or even the City Council, they do ask us as staff to kind of, to be addressing those questions.
Great. And then
I did have a question for the group. If you
okay, yeah, quick, we need to move into our action.
One question I had for you all is, does anyone have any experience with utilizing health impact assessments on plans like these? Do you all?
Well,
yeah. You guys already talked about that?
No, we haven't talked about that at all.
Okay, yeah. I didn't know, because we've been approached recently about this, and I don't know a lot about HIAs and, you know, if it's a useful tool or not, and so I was curious to see if people had ideas.
Short answer is it can be useful.
It depends.
Yeah, it depends, but it has been useful in some respects, maybe more useful than in others. But
okay, well, maybe we can continue to chat.
Yeah. I just want to sort of call out a couple of issues that have sort of come up a fair bit, both this morning and this afternoon. I'm going to suggest that we form basically. Let's do these two tables for people who would be interested in focusing on empowered communities. That table back there for people interested in thinking about housing. And then this one over here for people interested in thinking about parks. Does that work? For each, each piece of paper is going to have one action written on it. And what I would like you all to do is to, as a group, brainstorm and write down at least 5 actions. 1 action per piece of paper.
Go home and buy a stinky ball.
What is that? How is this stuff up there? Is that?
All right, everybody, let's give Ray our undivided attention.
Well, so we had trouble because we realized that we're talking about community empowerment, but all of us at the table are we can't speak to the same exact action items when we get out of here because we're not coming from the same place. So we just talked about different things, and we kind of went back and forth between community and the sustainability planning and the sustainability bureau, and we just talked about all of us when we're doing this work, identify existing efforts. We can't recreate the wheel, and also the same thing that we were talking about in continuation with Verde, just like go to where people are, really recognize, what efforts are already in place and build them up rather than start brand new. And then we talked about at different levels, encouraging our organizations and ourselves and our bosses or whatever to reframe outreach budgets, and that being the focus groups and that type of listening sessions, like really scrutinize that and think about where we're willing to invest our money. So we were talking at the table about how it's not common to put in money for food or childcare at a lot of places, and how maybe that should be just common line items that we should really prioritize in combination with these other things of going to the community rather than hosting your own new efforts.
Okay.
Did I miss anything, guys?
Good. Yeah, so certainly within that too, I mean, there's a lot of additional stuff to be done, and hopefully as you all sort of go back to your communities and see different projects and policies and plans being developed and whatnot, really think about how to put those into action. And I don't know if you all got to the level of asking Michelle and Julia, how can we provide input to reframe the outreach budget for EPS, which might be a little arcane, but good luck with that.
We changed it from parks to, sorry this can be hard to read for some of you, but it's about nature in our neighborhoods. Thinking about, instead of an actual park, thinking about how do we increase people's valuing of nature in the neighborhood, enhancing nature in the neighborhoods. Our neighborhoods are constantly losing nature for the most part. And we came up with a ton of different ideas. One is about teaching the stewardship of trees, of neighborhood trees. Friends of Trees maybe coming into your neighborhood doing a little talk about, they do that a lot. And so we thought that was a good idea to get people to appreciate why we have trees, why we need trees. There's still folks who don't fully understand that. We talked also about school gardens as a great entry point for children and getting them to think about how the importance of nature, how they can help affect nature. Also in sort of this idea of would schools even consider getting kids involved with landscaping of trees and shrubbery on the property, but then can we talk to every school, maybe initiating a garden program. There's a Portland Fruit Tree Project, Zinger Farms, a couple of nonprofits that kind of do that work that we could bring in. Here's another one that Friends of Trees and urban forestry is involved in completing a tree inventory in your neighborhood. It's amazing, the sort of citizen science thing of kind of going out there and doing an inventory makes people value it more if you actually count things and designate things. Let's see. This is individual. This was about what flag lots and how folks are selling off pieces of their property, taking out large trees. This is about talking to city bureaus, commissions about zoning concerns around the flag lot issue and subdividing property. So also opportunities to lose nature or opportunities to preserve nature as well. Sorry, we have a lot of things here. This is about protecting, this is sort of related to this up here, but protecting old mature trees. That article in the paper, was it today or yesterday, about cutting down this incredible old tree in the neighborhood, trying to stop them. Talking to the city urban forestry department about maybe best practices to get the community to support the saving of old trees. And this one, let's see, contact Oregon Food Bank, multi-language, what was that one again?
For cleaning, for people that have orchard trees in their properties and they let the fruit rot and they don't know that there's a cleaning
program that Oregon Food Bank could help people
The disease
get.
prevention, I think it will be with Friends of Trees.
Oh, yeah. Okay.
Great. Last but not least, housing. Craig.
So we decided to focus specifically on working to repeal the state ban on inclusionary zoning. Are you laughing at this idea? It's going to happen in like a year. So the first thing to do is to reach out to community leaders and organizations to create a coalition. If we can't get a broad coalition working on this, there's no way it's going to pass, given the opposition of the Home Builders Association and such. So that's number one, is to make sure that this is going to be feasible and that there's a lot of community organizations who are willing to be a part. And then early on, maybe even before that outreach, is write the 30-second elevator pitch. Maybe in 30 seconds, can we say why this is a problem, and why this policy change needs to happen, and how that's going to benefit the community. We also need to educate the community on this issue of what is inclusionary zoning and why is there a ban and why do we need to repeal it, but also on the policy-making process so the community can be involved with building the political will to make the policy change. We need to do a little bit of research, maybe something that's already out there, but we need to define the benefits of the policy change so that we can really get, when we start talking to legislators and the policymakers, they're going to want to know exactly what is going to happen. Maybe we could do a health impact assessment on repealing the inclusionary zoning ban. And then a big part of the project is going to be assessing the political feasibility and meeting with legislators to see what is it going to take, to really to get the legislature to make this policy change. One thing I like about this is the first step in this inclusionary zoning thing is pretty simple. It's repealing the state ban. There's a lot of devil in the details about how to do this well, but the first step, you don't have to go into the details. It's just like, cities and counties should have the right to mandate inclusionary zoning if they want to. And so getting rid of that state ban, it's sort of a pretty simple first step, though of course it will take a lot of work to get the legislature to do that. Anything else from our table?
Great. That's what you're going to do in the next month?